Free health and wellness resources will soon be available in the Raleigh area, thanks in part to a program started by the Shelby County government and UTHSC College of Medicine several years ago. Well, to learn more about this new facility, we are joined by Dr. Jim Bailey, the executive director of the Tennessee Population Health Consortium, and Amaya Wright, a summer intern with the county mayor's office. Okay, Dr. Bailey, you were explaining that this is going to make healthcare the fabric of the community there. Can you explain, what do you mean by that?
Well, what I mean is we know how the traditional healthcare system works. We wait until people are desperately ill. They have a stroke or a heart attack, and then we pull out all the resources to try and bring people back from the brink of death. Well, this is the entirely opposite approach. What we're talking about is community-based, community-rooted healthcare with people from the community serving as health coaches to help people chart their path to better health and prevent all those disasters for families and for communities.
All right, because you have to get those habits on the front end that change the outcomes. So Maya, talk to us about your work there.
So yes, this past summer I've been interning with Mary Lee Harris, the Office of Innovation. And so basically we've just been planning this event along with UC Health so that we can get those health screenings in so that people can come and find out about our new Raleigh location.
Wow. Okay, so what can people expect? And I always like to talk about the person too. I mean, what drew you to this project specifically? So
what drew me is that I want to be able to give back to other people and give back to the community. And as someone who has grandparents who have diabetes, high blood pressure, and just making sure that they are okay, I feel like it is important to know where you can go to get those resources. So I feel like partnering with UT is a good thing.
Okay, so what happens when we get there?
Well, it's a very simple process, and one thing we've learned is that making preventive care really convenient and easy. So people can drop in or they can make an appointment and they quickly get a little information about their needs, about the person's needs. It's not just asking about your insurance, right? And then we screen people for high blood pressure, for overweight and obesity, and for diabetes, check their blood sugar. And then we offer everyone who comes in opportunity to participate in personal health coaching, to have your own personal health coach who's highly trained and from the community being served. And then people can either do just individual health coaching or participate in groups that help people chart their own path to better health and higher quality of life.
And as you've been planning this, what are some of the outcomes, Amaya, that the team has hoped to achieve?
So we hope that people will know more about their health and will feel educated once they leave. So like we said, having those health screenings, after that you'll be able to go out even into your community and bring other people to that Raleigh location.
Okay, how is this funded?
So it's this program is funded by Shelby County government. And we are incredibly thankful that our government has had the foresight to emphasize prevention and encourage insurance companies to pay for it, because they ought to be putting that first.
I mean, a healthy community means that it's a productive community, right? So
exactly. And a happier community, right? So many of our neighbors don't have to suffer, you know, the harms of a stroke or a heart attack and have their productive and quality life cut short prematurely. So we try to be people's and families' best advocates.
Okay, so if I say I saw this piece and I'm like, you know what, I want to do the screenings, what happens? How do I engage, and what's open and where is it located?
So it's located at 3620 Austin P Highway. The health screenings will be taking place after the ribbon cutting from 11 a.m. to 1 p.m.
What date is that again?
July 28th.
July 28th. So
yes.
after that, it's open kind of like banking hours.
That's exactly right. 8:30 to 4:30, more or less, every day of the week. And
7 days?
5 days.
Oh, five, okay.
I'm sorry. We do have special events, often on the weekends or different times, but our main hours are from 8:30 to 4:30, except on Friday we close a little earlier at 3:30. But every day we have individual health coaching. You can come in quickly, get your blood pressure checked, come in and leave. Or participate in a group or a cooking class or an exercise class. So it's really about bringing neighbors together to help one another.
With health at the focus, but don't come there for the ER, okay? Like if you have an emergency, go to the ER, right? Because,
That's exactly right. That's exactly right.
All right, and
yeah.
Everyone invited to the ribbon cutting? Like
Everyone is invited to the ribbon cutting. Come see Commissioner Caswell, come see the mayor and Mayor Harris, and participate, and that's from 10 to 10:30. And then from 11 to 1, we have a special health screening and bling and things that will
Oh,
be
not the
fun.
bling.
Yes,
Okay.
indeed. So fun for people to participate in.
Thank you, Dr. Raleigh. And Maya, thank you. I cannot wait to watch your future. I'm so glad you're starting now, and I just can't wait. Like,
Thank
just
you.
go get them.